So I see you made the appointment today because you've noticed some bruises on your legs?
Yes. At first I thought I might have bumped into something without noticing. I did not think much of them at first. You see, people get bruises all the time, but then these purple badges of honour, as I called them initially, didn't go away as they should. That was when I started to pay more attention to them. And when I see more of them, I felt I had to see someone.
So how long ago did you start noticing the bruises?
Was it 2 months ago? No, I don't think it was that far back. If I had to put a finger on it, I'd say probably about a month and a half ago. Yes, that should be right about the time I had that first bad menstrual cycle.
Bad menstrual cycle? What do you mean by that? Was there a lot of cramping?
No, no pain or anything of the sort. It was just abnormally heavy. I am 36 years old, and so I'm pretty familiar with my cycle, but these last two periods made me feel like a teenager all over again.
I see. And any other unusual bleeding?
But it's funny you should mention that. Yes, I had a major nosebleed about 3 weeks ago. It was so strange because I've never had one in my life before then. But one day I was at work and in the middle of a phone call with a client, and boom, I noticed blood dripping on my desk. It took about 15 minutes or so to stop.
I see. That must have been quite distressing for you to have that happen at work. Does anyone in your family have any bleeding disorders?
No, not that I'm aware of.
Right. And have you made any changes to your lifestyle recently, such as starting to drink or smoke?
No, not at all. I've never smoked and I only drink occasionally, like at parties or social events, things like that. I have an 11-year-old daughter to take care of, so not much time for going out and drinking.
So I can see that you have multiple areas of purpura on your legs. Here are some more on your abdomen and arms. But these are not as severe as the ones on your legs. They vary in colour quite a bit, from black, purple to yellow.
Yes, that is how they've been for the last month or so. More on my legs and with a rainbow of colours.
I also see that you have two bullae in your mouth. Have you had any incidents of your gums bleeding?
Yes, a bit, like when I brush my teeth. But it does seem to take quite a long time to stop. Oh dear, are all these bleeding episodes related to my bruises?
Well, we'll see if we can figure that out today. So here I have the results from the blood tests that I ordered when you called in to make the appointment. There are a few areas of concern, such as your hemoglobin is slightly lower than the normal range, but that is not what is most concerning. What worries me the most is that your platelet count is far below the normal range.
How far below? What does that mean?
Let's just say that your platelet count is almost non-existent compared to what is normal. To put some numbers on it, people normally have 150,000 to 450,000 platelets per microliter of blood, and your platelet count is at 4,000.
Oh no, you're right, almost non-existent. But what does that mean?
Platelet defects can cause spontaneous purpura or bruising on the skin, and they can also result in unusually heavy menstrual flows and bleeding from the gums or nose, all symptoms that you have experienced. Other symptoms include prolonged bleeding from cuts, bleeding in urine or stool, and jaundice, which you are not experiencing at this time.
So what causes it?
There are two possible causes: reduced production of platelets or decreased survival of platelets. We'll have to run further tests to see what category you fall into, but for now, you're going to be immediately referred to the hematology unit for a platelet transfusion. With platelet counts so low, you're at a high risk for a major spontaneous bleed.
And is this something I'll have to deal with for the rest of my life?
Yes, unfortunately, the disease tends to run a remitting and relapsing course, but as long as it is managed. How are you today?
I'm okay, Dr. Silverson, but do call me Sally.
Yes, Sally. So we saw each other a couple of months ago for your yearly checkup, so I was quite surprised to see your name down for an appointment today.
Yes. Dr. Silverson, I hesitated to make this appointment because there really isn't anything specifically wrong with me, but I just cannot shake the feeling that something is wrong.
What do you mean? If you feel poorly, then something is likely wrong, especially considering that you did turn 85 last month. Can I just say, you don't look a day over 65, but records don't lie.
Thanks very much. I have actually been telling people I'm 70 to see if I can get away with it. Wow. Yes, you are right. My age makes any health issue more serious.
So what seems to be the problem?
Well, I've been feeling so tired lately. I started noticing it when I had my grandkids over for Christmas. That was 4 months ago, was it?
No, Christmas was a good 6 months ago.
Oh, dear me. Where has the time gone? So, yeah, if I were to trace it to a time when it started, I'd say Christmas. But when I came to my checkup, I didn't mention it because I just thought it was, well, old age, I guess. But I'm still feeling quite tired, months later.
Okay, anything else besides the tiredness? Any loss of appetite or nausea?
Now that you mention it, I've not had much of an appetite lately, and I do sometimes feel a bit nauseated.
Let's see how your weight is looking. Oh my, so when you came in for your checkup a few months ago, you'd lost 1 kilo, which wasn't so alarming at the time, but since then, you've lost 7 more kilos in just a few months.
Seriously? I knew my clothes were a bit looser, but that's a lot. Also, I just in the past 3 weeks started experiencing some generalized itching and cramping in my muscles. It comes and goes, but I think it started about 3 weeks ago.
So let's see. I can see that along with these recent changes in your health, you have also been hypertensive for the past 2 decades.
Yes, and I've been taking my antihypertensive medication for that long as well.
Wait a second, your blood pressure is very high, 190 over 110. We'll need to change medications to get it under control.
Oh my, that is very high. I promised Doctor I take my medication every day at the same time, right after that Meals on Wheels service delivers my lunch. I never forget. And my daughters are very good about filling my prescription.
Other than that, do you have any other problems of late?
Well, my girls sometimes comment on my eyes. They say the red reminds them of the time one of them had conjunctivitis. I'm sure they're just exaggerating, but yeah, I guess that's just how it looks. It's not bothering me, though.
Right. Anything else?
Gosh, if I want to really tell you everything, it'll be a shopping list. But if you must know, this old woman sometimes gets split-second dizzy spells. I could be standing washing the dishes, and I would get this feeling that just passes. I'm sure it's nothing.
Well, it may be associated with your hypertension. Let's just be sure. Here's what's going to happen next. I'm going to send off for some blood tests to check levels of urea and creatine. But the symptoms that you're describing, lack of appetite, nausea, weight loss, fatigue, cramping, and itching, they're all consistent with end-stage renal failure. Also, it is essential that I do a renal ultrasound. It will allow us to accurately size the kidneys as well as identify causes for renal failure.
Renal failure? But I thought the problem was with my blood pressure.
Yes, it is, but hypertension is damaging to kidneys.
Will I need dialysis? I have had some friends who have needed it, and it seems awful.
You may need it, but there are many possible options, such as a hospital and home-based dialysis. We will cross that bridge when we get to it. For now, I am more concerned about